Hello everyone, welcome to this course Kinematic Assessment and Human Movement. My name is Dongwon Hwang. Today's topic is basic science. This is the second video for anatomical terminology. In the last video, we dealt with standard position as well as anatomical planes and axes. In this video, I will talk more about anatomical terms of location and motion. Now we start with terms of location. On the left, there is a human body in the standard position on the coronal plane. I will start with the familiar terms superior and inferior. As you see, superior means higher and inferior is lower. These terms are relative. You can use them when you compare the locations of the body parts. For example, the head is superior to the shoulder, the chest is inferior to the neck. The next is medial and lateral. So our body is symmetric, so you can draw an imaginary midline. Medial is close to the midline, and lateral is away from the midline. You can say the ears are lateral to the eyes, and the neck is medial to the shoulder. Now we have a question. How do we describe the hands? Sometimes it is higher than the head, and sometimes lower than the hip. So there are terms proximal and distal. These terms are applicable to the structure which has the beginning and the end, like arms and legs. Proximal means close to the beginning, and distal means farther away, meaning close to the end. The finger is distal to the wrist, the knee is proximal to the ankle. Now, look at the right. The body is shown on the sagittal plane. We know anterior is front and posterior is back. In anatomy, there are other terms, ventral and dorsal. Ventral is towards the belly and dorsal is towards the back. For humans, anterior and ventral have the same direction. The posterior and dorsal are the same. However, for four-legged animals like dogs and horses, it should be different because the belly is towards the ground, meaning that ventral is inferior and the dorsal is superior. Let's talk about cranial and caudal. Cranial means the direction to the head, caudal is toward the tail. For humans, cranial means the same as superior and caudal is the same as inferior. For dogs and horses, cranial means anterior and caudal means posterior. Now, we move on terms of motion. These terms are related to joint motion. In this slide, I will talk about flexion and extension. You might already know about it. On the left, there is the elbow. This motion is the flexion, meaning bending the elbow. The angle of the elbow decreases. The extension is this motion and increases the angle. Look at the right. There is the knee. This motion is a flexion and this is extension. We can also define flexion and extension with the shoulder. But the shoulder has a larger range of motion than the elbow and knee. So the hyperextension is defined. It is the same for the hip. There is flexion, extension, and hyperextension. How about the neck? This is flexion, extension, and hyperextension. For the wrist on the right, flexion, extension, hyperextension. When the body is stand up in the standard position, flexion, extension, and hyperextension are observed in the sagittal plane. On the other hand, there are lateral flexion. On the left, you can see lateral flexion of the neck, and on the right, this is for the trunk. As you see, this is a bending motion toward lateral direction. In the standard position, lateral flexion is observed on the coronal plane. So you can say lateral flexion is coronal plane motion. The next is abduction and adduction. There are also coronal plane motions. From the left, there are examples for the shoulder, the wrist, and the hip. When the movement is away from the middle line of the body, it is abduction. When the movement is toward the middle line, it is adduction. For the shoulder, the angle between the arm and trunk is over 90 degrees. It is going to be closer to the middle line again, being closer to the head. But the angle between the arm and trunk is higher. It is also defined as abduction. The next one is circumduction. The left is an example for a shoulder and the right is for the hip. When you draw a circle using a shoulder or hip joint, it is a circumduction. This movement is a combination of flexion, extension, abduction, and adduction. It happens to the socket structure like a shoulder or hip joint and eyes. Now we talk about rotation. The left shows the medial rotation of the hip, which is rotating toward the middle line, and the right shows the lateral rotation, which is rotating away from the middle line. This is about pronation and supination. If you rotate your hand and show the backside of the palm, it is a pronation. The backside of the palm is palm posterior. When you rotate your hand and show the palm, called palm anterior, it is a supination. For the ankle, the supination is bending motion toward the middle line. The pronation is bending away from the middle line. When it is straight, we can say neutral. In gait analysis, this is one of the important points to determine the normal or abnormal gait. Here are more ankle movements. If you raise the front of the foot toward the shin, it is dorsiflexion, so the angle of the foot and shin decreases. For the opposite direction, plantar flexion is defined, so the angle of the shin and foot increases. There are inversion and eversion. Inversion is the tilt motion of the sole of your foot toward the midline of the body. Eversion is the tilt motion away from the midline. Now, we move on scapular motion of the shoulder. Scapular motion is named after scapular bones of the shoulder. So elevation is shoulder motion towards upper direction. Depression is towards lower direction. There are protraction and retraction. Protraction is a shoulder motion towards anterior direction, and retraction is towards posterior direction. The scapular bones can be rotated up and down. When you raise up your arms, this is upward rotation. When your arms are down again, this is a downward rotation. Thank you for your attention. For the next video, please click the video on the bottom right, and for the previous video, please click the video on the bottom left.